Weekend Clinic Lab Rapid Strep Training. Here is the Rapid Strep box. On the outside of the box you will be able to see the expiration date and see where it has been marked that QC has been done. Inside each box you will find a positive control as well as a negative control. QC will be performed by the lab, and if a box is in the Weekend Clinic Lab, then that means it is ready to be used, and that is not something you will have to worry about. For us to get started on patient testing, you want to ensure that the swab is labeled with 2 patient identifiers and that this is a rayon-tipped swab. It is also a good practice to put the patient label on the back side of the swab so you are able to see what swab you are using. With your appropriate PPE on, we're going to start by filling out the clinician copy result log with 2 patient identifiers and marking what test we will be doing. To perform this test, you're going to need a plastic reagent test tube, which can be found inside the box, as well as the reagent 1 with the red lid, and reagent 2, which will have the white lid. To begin patient testing, we will be adding 3 drops of reagent 1 into the plastic test tube. Here you will be able to see that the color of this reagent is a reddish pink color. And now you will be adding 3 drops of reagent 2 into the test tube. Here you'll want to be able to see the color change in the test tube from that red to the light yellow to ensure that both reagents have been added to the test tube. Now again, ensuring that our swab does have the 2 patient identifiers and is also the rayon tip swab, you'll want to insert this into our plastic reagent test tube with the liquid and vigorously mix the swab in the liquid 10 times by rotating that swab. After this is done, we will be setting a 1-minute timer to allow the swab to set in the solution for this time. After that 1 minute is up, we will remove the swab from the reagent, but ensuring that we are able to get as much liquid from that swab as possible, you will want to pinch down on the plastic test tube to expel as much liquid as you can. Now we will be adding our reagent test strip into our plastic testing tube, ensuring that the absorbent pad is inserted into the tube according to the arrows on the strip. You'll immediately recap the test strip container and set a timer for 5 minutes. After the 5 minutes has lapsed, this is when you will be able to interpret your patient results. Here you can see that our patient sample is negative as it has a clear background with the 1 pink control line. All testing material needs to be placed into biohazard waste once you are done. Now we will be recording our patient results on the clinician copy result page and being sure to fill out the bottom with who did the testing and time in and out of the laboratory. Next, we will be filling out the Weekend Clinic result book under our Strep tab. You'll want to be sure to have 2 patient identifiers on this, which you will have spaces provided for you to fill that out. You will also be filling out that you did see the reagent color change from that pink to the yellow color, along with the background being clear so that you were able to easily see the test lines. And lastly, that you did see that pink control line. Also, this result book under the Strep tab is a continuous log, so you do not have to start a new page with each day of testing. You are able to fill it out right underneath the last result and continue to the next page as you need to and as it fills up. Now you can see the example that I have filled out the patient result in full, ensuring that I did mark the 3 areas that I needed to. Now for a quick overview, with this reference being posted in the Weekend Clinic Lab. Step 1, you will add 3 drops of reagent 1 and 3 drops of reagent 2 into the plastic testing tube, being sure to see that light yellow color change. Step 2, mix the swab by swirling it 10 times and allowing it to sit for 1 minute in the solution. Step 3, after the 1 minute incubation, you're going to pinch the tube when removing the swab to ensure you remove as much liquid from it as you can. Step 4, add the test strip absorbent pad down into the liquid for 5 minutes. And step 5, you will interpret the results. Positive will have a red-pink control line and a blue sample line. A negative will have only the red-pink control line. And an invalid test would be considered no control line, or that you are unable to see the lines at all.